and we shall continue playing the game. Gross and microscopy explained. The topic for the day is necrosis. Though I am going to restrict myself to the gross and microscopy, you should remember that it can be an essay, a short note in pathology or surgery, a short case again in surgery, spotter, slide in the practicals, and an MCQ in either subject. Okay, since it is somewhat rainiform in shape, and then there are some striations, I presume that it is a kidney. Actually, we should identify by means of the ureter and so on. There is an external capsule. Also, there is a pale area which is somewhat pyramidal or triangular. On the other side, there is a microscopic picture which is again showing a pale area that is guarded on either side by deep blue dots indicating the nuclei. My question now to the students is, why is it wedge-shaped? We call it a wedge-shaped or a triangular infarct. Why is it wedge-shaped? I would like you people to compare this. Always I like comparing. This is actually an aerial view, the delta of a river rather, and then it shows multiple branches. Finally, you find that they all go into the sea. And this is the plain where it is very fertile. Now, what will happen when there is going to be a damming of the river water? All this will be obstructed and this entire area becomes dried up. So also, in any parenchymal organ, you find that there will be a triangular one, and this will be a major blood vessel from which there are branches and rebranches, producing a roughly triangular area of supply. And when the apex is being obstructed, all these are without any flow of blood, and there is an infarct. After all, what is an infarct? An infarct is an area of localized necrosis caused by the sudden, complete, and irreversible occlusion to the vascular flow. This I shall go to in detail when I come to the general pathology. I would like you people to kindly appreciate that beneath the capsule, there are some blue dots indicating that it is viable or live. And on the sides, it is again viable or live, whereas this area of infarct is pale. That is why it is called a pale infarct or a white infarct. It is wedge-shaped, it is pale, it is well demarcated, and there is a subcapsular zone that is viable. And the margins of the infarct show evidence of congestion and inflammation. Viable areas of dark reddish brown areas can be seen, and the viable area is nucleated. Why it is brownish red, etc.? It is because of the increased capillary proliferation. This is a microscopic slide of the same, and this can be kept for the examination. A coagulative necrosis of the kidney, one of the first slides which is quite difficult for the students to comprehend. I am able to see two areas, a necrotic area and a viable area. What are the major differences between my right and left? Here I find multiple blue dots which indicate the nuclei. So they are all nucleated areas, whereas this area is pale and I do not see any nuclei within. So this is an area of pale infarct or a white infarct. At the same time, I should be clever enough to notice that the outline of the tubules is well maintained. Also, if I go to the high magnification, I may see the cellular outline without any nuclear details. Look at this one. This is a live renal parenchyma. I am able to see the nuclei and maybe these are all the cellular outlines. So it is well preserved. Here also it is preserved, but there is no nucleus, there is no life. That is why it is described as a city of the dead or a tombstone appearance. That is because of coagulation. The protein undergoes rapid coagulation and the outline is maintained, just like a boiled egg. I would like you to compare. As in my previous session, I always say compare. So pale, eosinophilic, anucleate areas with the maintenance of the tubular outlines. Whereas here, I am able to see the nuclei. So this is one. I am able to see a renal parenchyma. I am able to see the nuclei, the tubules again. There are some degenerative changes. Let us forget it. The cytoplasm is blue. This is viable. Whereas, look at this one. I am not able to see a single nucleus. These are all inflammatory cells in the necrotic area. I am not able to see a single nucleus. So this is an area of coagulative necrosis. If you have got some doubt, again compare. So I hope you people will be able to make a diagnosis. In your examination, you will be focused a slide. Usually we do is the junction of the live and the necrotic area is being focused so that you people can make a diagnosis. And generally you should look for a glomerulus. Otherwise, it is difficult for us to diagnose that it is the kidney. So it is a case of coagulative necrosis of the kidney. And the description will be as follows. The cells have got a pale eosinophilic cytoplasm, tubular outline is preserved, cellular outline is preserved, no nuclei. There is a sharp line of demarcation between the dead and the viable area. The intervening zone will show capillaries and inflammatory cells. The viable area may show inflammatory cells as well as the viable cells with nuclei. So I hope you people will be able to write this description if you get a slide of coagulative necrosis and you can draw this picture. Now it is for you. What is your comment? What is A? What is B? Even at this magnification, I can see multiple small dots at regular intervals. So this is a viable, that is a live kidney, whereas here it is pale and anucleate, and even the glomerulus is not having any nuclei. So it is a case of necrosis, a coagulative necrosis of the kidney. See you in G.A.M.E 11.